Hi everyone and welcome to Mighty Kiddos. In today's video, we will be discussing the differences between physical therapy and occupational therapy. At the end of the video, I will be sharing with you some red flags to look out for, and I will be pointing you in the direction of the right professional that can help you. So if you're interested, stay tuned. As an infant development specialist, parents often ask me, what is the difference between physical therapy and occupational therapy? Occupational therapists focus on function of daily life. That includes eating, getting dressed, playing skills, and even learning skills. They also help increase or develop age-appropriate skills for fine motor development. Fine motor skills are the skills that depend on our small muscle movements. So for instance, muscles in our hands, wrist, toes, lips, and tongue. Another thing that occupational therapists do is that they're trained in sensory processing disorders. Some skills that your occupational therapist may focus on is hand and eye coordination, fine motor skills, feeding skills, self-help tasks, body awareness, attention, and sensory processing abilities. On the other hand, physical therapists focus on mobility and gross motor skills. So their focus is going to be on independence and functionality of gross motor skills. These professionals are trained in working with children that have had injuries or that are having difficulties due to developmental delays or disabilities. Now, some of the skills that you can expect your pediatric physical therapist to work on are motor planning, motor control, balance, coordination, flexibility, and gross motor development, strength, and gait mechanics, which basically refers to the way your child walks, steps, and stands. Now, there's a lot of overlap between these professions, so it is very often confusing for parents. If you are ever in doubt of what therapy your child needs, always talk to your general practitioner or child's pediatrician. Tell them your concerns, and they should be able to help you find the correct professional to assist your child. If your child is demonstrating delays in fine motor skills, if your child isn't drinking from an open cup or from a straw at an age-appropriate time, and your child is demonstrating sensory processing difficulties, it is a good idea to reach out to an occupational therapist. Also, if your child is demonstrating either low muscle tone or high muscle tone that is not appropriate for their age, reach out to an occupational therapist. If your child is demonstrating feeding issues, poor balance, and poor ball skills for his age, it is also a great idea to reach out to an occupational therapist. On the other hand, if your child has a diagnosis of cerebral palsy, autism, or Down syndrome, it is a good idea to reach out to a physical therapist to help your child meet all his or her gross motor skills. And also, if your child is having delays in any gross motor skill or has torticollis, having a physical therapist as part of your team will be very helpful. So there you have it, guys. Now you know the difference between occupational therapy and physical therapy. If you have any questions, don't hesitate to leave them down below. Also, like and share this video if you found it helpful. Thank you so much for your time, and I will see you on our next one. Bye.